Dear students, uh, so I know you are all enjoying the in-depth discussion of the several topics in the form of foundation course in the entire 1 year, I mean 1 week or so. So we are into second week of the foundation course. Today's topic, you are well aware that it is a discussion regarding the core values of the physician. So core values of the physician. Before me sharing few of my knowledge, few of the aspects regarding the core values of the physician. Let me introduce myself first. So I am Dr. Narayana Murthy, professor and head of the department of pathology, Basveshwara Medical College, Chitradurga. I am working here since the inception of the college, and I write from the first batch of students. I have seen all the students. I have taught so many subjects, and even have learned so many things from my students. So you know one proverb: few things we can learn from our teachers, many things we can learn from our colleagues, and all the things we can learn from our students. So with this proverb, with a brief introduction of myself, let me thank in the beginning itself, so that let me not forget the people who helped me to for this today's session. I thank Dean and the new coordinator, and especially Kanya Madam, and more importantly Dr. Yogesh and Ramu in his absence. Today Chandan and Amrita Madam is there, Nalina Madam is there, who is going to share her knowledge, enlighten you. Especially Dr. Yogesh, who yesterday came to me, he told, sir, you being a senior, instead of teaching the regular things, whatever that is there in the books are available in the available material, you should share your knowledge, enlighten our students. Your 15 to 20 years of experience, you should share with the students, tell the stories what exactly happened. You only came out with an idea. In this big library, I could find two videos which will fit into this situation. Thanks to Dr. Yogesh once again. So today, before me, yesterday actually in the application form I just filled, I'm just going to do an PPT presentation with a lecture. Later, I thought, let me ask you few basic questions. I'll come to the uh, core topic of today's discussion with these few questions. Uh, Let me ask you a few questions. If it is an online, offline class, I just wanted each and every student to come onto the stage and answer this question. My question to you today is, why did you join medicine? Can anybody answer, why did you join medicine? Can you hear me, students?
Students, be interactive. When sir asks you something, please respond so that he knows that you are listening.
Sir, for the satisfaction of helping others and having a purpose in life.
Sorry?
Can you say that again, please?
Say that again, please. Satisfaction. Satisfaction of helping the people. Okay. Any other the answers? Students, please interact. Why did you join medicine? Right through almost one and a half year, you were into books, preparing for the NEET exams and second PUC exams. Majority of you left homes, joined some residential school, studied day and night, and took medicine as a first option and joined here. Why did you join medicine? Just
You can speak out now.
whatever you can say, ma'am, so that I can
Uh,
catch and discuss.
Meghna says to help patients and to do selfless work. And Niharika says learning about human body is fascinating.
Okay.
And Vanilla says to serve society, and it is one of the noble professions. My main aim is to give free treatment in rural areas where facilities are not properly given to needy patients.
Okay.
Kavana says to serve the society and look after their well-being.
Okay, various inputs have come. All these inputs are really one who told giving the treatment in rural areas and giving the better treatment to serve the human beings. So it's a noble profession. All these things are excellent. And if you join medicine just because your parents own a nursing home or your parents are insisting for this profession or your neighbor is a doctor who owns Mercedes Benz or Audi, you feel for earning this is a very good profession, then don't, then this is not the right profession. So if you are just come here to continue the business or continue the nursing home that was set up by your parents with their hard work, it is not a business, it is a service. So keeping all these things in mind, I am very sure all our students know this, that you people have joined medicine. Money will be there, money will come automatically when you do service, selfless service. So knowing all these things, I think you are very clear that why did you join medicine. Medicine is a long journey, 5.5 years, 4.5 years plus 1 year internship, then 3 years master degree, then again preparation for that 1 or 2 years, then doing your is a super specialization in the form of DM cardiology and urology. Recently, one of my students joined DM critical care. Other student of mine, many of the students have done PG and UG here only, and they are working with very honesty in our institution only. So there are plenty of options, and it's a long journey. And you feel very very enjoyment in each and every day. It is, I'm not degrading other profession, like wherein in some profession you need to study regarding the computers or something like that, which is man-made. Here God made human beings. We are studying about ourselves. We are studying about ourselves. We are studying about our body, our own human body. So you can enjoy each and every day. So with this core, now today we shall discuss regarding the core values of the physician. So core values of the physician, as per the literature that is available, there are plenty of options, there are plenty of answers I could find. Altruism, that is selflessness, best interest of the patient, not for their own interest, that is altruism. Next is accountability, excellence, duty and integrity, and honor and integrity, respect for the others, other commitments. All these things I can show you, or we can discuss when I show the PPT. But with my experience, I thought ABCD of successful doctor, or basic ABCD of the physician is ABCD. That is, A is availability and accountability. You see any successful practitioner, I've seen doctors who are practicing here, who are teaching here for more than 40 years. I have just observed silently what their behavior is. They are available always, whether it is in the department or if they are outside doing the practice. They are available all the time. They are accountable, and their behavior is down to earth. You cannot make out that they are so much experienced. Their behavior is down to earth. They are not rude to the patient. They are not rude to the colleagues. They are not rude to the students. Students may do 100 mistakes. Patient will irritate you by asking the same question 100 times. One time patient will come, other time patient relatives. Suddenly some people will come from their village, again ask the same question. More than giving to the treatment, sometimes you need to spend more time explaining all things what you have done to the patient. So their behavior, I have observed, they are very cool and calm in spite of pressures from all the sides. Next is C, that is competency and communicability. They are competent in their work, definitely. Just because they are competent, they are surviving in this field. Next is communicability. They'll understand the person whom they are discussing, their level. They'll understand. They'll go to their level. They'll go to their standards and explain in their own language. That is communication. D is an important topic which I am supposed to deal with you today. That is duty and integrity. So duty and integrity of the physician is very important, and it is one of the two important aspects of the core values of the physician, which I will be enlightening today. So these ABCD, A is accountability and availability, B behavior, C communicating skills, and competency. Competency means samarthya. One competent means samartha. So ability, good ability to do the things. Next is duty bound and integrity. So these are the ABCD of successful physician, or ABCD of the core values of the physician that one should remember. So I have two videos for you. Sir, can I? So you can watch two different videos. Once you see, I'll just tell a few of my opinion regarding that, or in brief story regarding those two videos. Very short videos, but very educative videos. Please observe those two videos.
Sir, students, I have shared that link of YouTube video, which you can all click and watch it and come back immediately.
Please watch those two videos. One is regarding the patient who has admitted to ICU with an history of head injury, nasty head injury, and second is the discussion of the consultant with the patient regarding how to break the news, how to tell the diagnosis, how to take the patient into confidence. Those two videos, please go to those videos and get back to us, please.
Share that video also here.
It's Mr. O'Brien. He's crashing.
Call a code. Get a crash cart now. Call Dr. Smart now.
It's not. It's okay. You've had a nasty fall. You're at the hospital. Okay, let me recap your S-bar. Mr. O'Brien's a frail 7-year-old diabetic with a serious head injury. A CT scan was done and revealed a small subdural, but it's not big enough to operate on, but it needs monitoring. He's alert. His Glasgow coma scale is 15. Vitals are okay. Blood pressure is 130/80. Pulse 90. Pulse ox is good. Neurovitals every hour. Anything else I should know?
Larry Jones is the resident on service. He's in the hospital. Any problems, call him.
Thanks, Betty. Have a good night.
You too. Oh, I almost forgot. The staff overnight is Dr. Smart, and he's admitted to him. Smart can be a handful, so be careful with him.
Shoot. I had a terrible time with Dr. Smart last week. He's so rude and condescending. He's more like Dr. Smartass.
I don't feel very well. I'm too warm.
Do you have a headache? Larry, Mr. O'Brien doesn't feel well. I'm worried. Can you see him? His temperature's 38.9. He's Dr. Smart's patient. I think you should call him.
Well, sometimes people with a subdural can have a fever. Look, I'm covering thoracics and I have to go to the OR with Dr. Green. Dr. Smart doesn't want to be bothered unless it's very important. Don't worry, I'll be back as soon as I can.
Well, if you're going to be in the OR, shouldn't you call Dr. Smart so he can see the patient?
No, that is not a good idea. I gotta go.
Dr. Best, call 14928, please. Dr. Best, call 14928.
Dr. Smart, I'm sorry to disturb you. I'm a nurse on 4 North. I'm phoning about Mr. O'Brien. He's here because of a nasty fall.
Oh, spare me the details. I know his story. What do you want? And it's better not be about ordering Tylenol for a headache. Did you call my resident before disturbing me?
Yes, but Dr. Jones is busy in the OR with Dr. Green.
In the OR? What a surprise.
Mr. O'Brien has a fever now, and his blood pressure is a bit low.
Well, what's his blood pressure?
95/60, but he's got a fever.
Okay. So, what do you want me to do about it?
Well, the resident isn't available, and like I said, he's down in the OR.
Are you incompetent? Look, sweetie, call the resident back and get him to do his job and see the patient.
Can you check if Dr. Jones is finished in the OR? Okay, thanks.
Other video, both videos we have completed. This is the, I think everyone went through the chart video. So it was prepared for an educative purpose, where you could see one ICU patient who had a nasty head injury. The patient was in diabetic since 6 or 7 years, and at the time, initially the patient vitals were stable and BP was around somewhere 130 by 80, I think. But later, initially CT scan was done, follow-up CT scan was not done. Everyone knows that in the follow-up they can develop hematoma, subdural hematoma. So one should watch for the vitals and also regular close follow-up CT scan. So when the sister informs the duty doctor, and she informs the duty doctor as well regarding the vitals and the consultant, and you could see their response and finally what happened to the patient. So what do you think regarding this video? This is a regular video, nothing wrong with the video, or is there any mistake that you can find out from nurse, resident doctor, or a neurophysician? One was, instructing her over the phone. What they are doing is correct, or the patient fate is like that, or is there anything that they can do to give the best service to the patient?
The doctor should not have put down in the system. He should have taken the body that the system was prepared seriously.
Okay, they should have taken sister's suggestion seriously. He should have gone to the patient, see what is going wrong. Is it not? Then any other suggestions? What is your opinion? Okay, handling the surgery, they should have suggested. In the ICU, priority comes to the question. So those who need the top priority, immediate attention, they should be given immediate service. No doubt they are all busy. They are all working throughout their duty scheduled hours, but they should give priority to the patient who are really sick. Is it not? Then any other suggestions regarding these short videos? So, yeah. It should not have neglected. What's your good name? Okay. From which place? Okay, Sanjana, your thinking is correct actually. We should not have neglected. There is no question of negligence comes whether in the OPD or whether patient in the ward or patient is admitted in the ICU. So every complaint, every signs and symptoms we should elicit properly, make thorough evaluation. When they are in the ICU, here the remarks are vitals, changes in the vitals are given by one of the professionals. So it is not the patient who is telling. It is elicited by the nursing staff. So you should have taken it very seriously and attended it on top priority. Your observation is right. So in this short story, I feel there is the resident doctor, in spite of working after 8 hours, so no doubt he has worked for all the 8 hours or whatever the scheduled time for that person. After that, his time will get over. In spite of that, he might have seen and attended that patient and handed over to next duty doctor and wait for the next duty doctor to come and attend that patient, order for the repeat follow-up scan, because that patient has a diabetes and history of nasty head injury, and in a patient who is old patient and the patient is suffering from diabetes and BP was normal, suddenly the BP has come down 90/60, and the patient, importantly, she insisted, repeatedly tells that the patient is having fever with low BP. Definitely they could have attended, in spite of, they have done the good work, but they could have extended that good work by giving first priority to the patient who deserved immediate care. So that's why in the emergency medicine department there are 3 zones: red zone, yellow zone, and a green zone. Those who need immediate attention, they'll be treated in a red zone. Consequently, other priorities, the other patients which leads less priorities, no doubt they are serious, but you may take some time to treat those patients. They'll be categorically shifted to yellow and green zone to solve all these issues. Red, yellow, green zones are there in our hospital in the emergency medicine department. Those who are very sick, they will be under continuous observation and it will be kept in a critical zone. So with this, whether you are a consultant or a nursing staff or a resident, so everyone will have their role, and you should do it very effectively, or else the patient will suffer and system will collapse. So even if you are, you have overburdened, but you should attend at the time of crisis and extend your duty time and hand it over to the next consultant, irrespective of the outcome. That is what I feel. Thank you. That's a good feedback. Next video also I have one more short video. Can we play that one more video? So you have seen one video wherein you could find some negligence over the consultant who told over the phone, what could I do for that? And on the contrary, you can see one more video where the consultant will counsel the patient and take her into confidence before telling the actual diagnosis.
Hello, Mrs. Flores.
Hello, doctor.
How are you? So I've scheduled this meeting for us today to discuss the results of your breast biopsy, but I've actually given my pager and my cell phone to my nurse practitioner so that we don't get interrupted.
Okay.
Are you alone or did you come with someone?
No, my children had to work today, so I'm by myself.
Okay. So how are you doing?
I still get tired, and I get dizzy if I get too tired. I've got some knee problems, and yesterday I had some nausea. Better today. I think it's probably mostly because of the blood count, my anemia.
Okay.
So I think I'm okay.
How about any anxiety or depression?
Well, I'm really worried about the test. I have a lump, so I'm afraid. I don't know about that test they did with a needle.
Have these symptoms affected your life in general, your ability to complete your housework?
Well, I've cut back my volunteering at the nursing home, but I still babysit my grandchildren.
Okay, so my clinic and I can help you with all those symptoms. We'll go over that, at the end of this meeting and in the next couple of weeks. Before we go over the results of the breast biopsy, I would like to ask you one more question. How do you handle medical knowledge? Would you like all the details of your treatment? In my family, my mother would defer to her children, especially me. How do you handle medical knowledge?
Oh, you'll have to tell me. I want to know everything.
Okay, all right. So, Mrs. Flores, I'm afraid I don't have very good news for you today. The breast biopsy revealed that you have an invasive form of breast cancer. I'm sorry. I wish I had better news for you.
How can I have breast cancer? I make all my checkups. I have all my mammograms. I don't understand.
Well, unfortunately, despite routine checkups, cancer can occur in anyone.
How long have I had it?
It's very hard to tell, but you probably have had this for several months.
No one in my family has ever had cancer, except my husband. Could I have caught it from him?
No, cancer's not like a cold. It's uncertain why some people get cancer and others don't. Tell me about your husband.
He died of colon cancer. I nursed him.
Sorry to hear that.
So, I've seen how cancer can eat you up. It's ugly.
I know this comes as a shock to you.
I don't want to be in pain like he was.
My clinic and I, we're going to support you through this, and we're going to guarantee that we address your pain and all the symptoms that you're having. We're also going to be available for your family, okay? I'm glad you told me how you're feeling, because now I know where you're coming from. The next step is for you to be meeting with a medical oncologist. This is the cancer doctor and the general surgeon. Most likely they'll recommend the following, either to remove part or your entire breast. The goal of this surgery is to remove the cancer. This is going to be followed by radiation therapy and chemotherapy, and the goal is to make sure that we kill any remaining cancer cells that could be present after the surgery. I think we should focus on keeping you comfortable.
Am I gonna lose my hair?
Oh.
Am I gonna have to wear a diaper? My children are gonna have to take care of me.
Yeah.
Am I gonna die, doctor?
No, you still have many options available. In fact, I hope the best for you, okay?
I don't want to be in pain like my husband was.
My clinic and I are going to help with any symptoms you may have, including pain. I can help you with all these things. These are all issues that will arise. In fact, I'm a part of a team. In my team is a social worker. A social worker is available to you if you have any financial questions or issues. They're also available to you and your family in the event that you can no longer take care of yourself. They can provide services. And I have a great nurse specialist. She is very skilled in pain management and control of all your symptoms. She's also available for refills. And lastly, my chaplain, he can provide prayer or just basic counseling for you. Are you interested in any of these services?
I don't know, not now.
Okay. Here's a tissue. I can't imagine how you're feeling, but we're here to support you, and we want to provide you with the best medical care for you. We will support you in any way that we can, no matter what happens. Let's plan to meet February 1st. It's on a Tuesday at 9 a.m. So in the next couple of weeks, can you write down any questions that you may have for myself, the medical oncology team? Can you tell me in your own words what I have just said?
I have breast cancer. You're going to make an appointment for me with the cancer doctor to talk about treatment. But I'm going to get better. But I'm afraid. I'm afraid of what it's going to do to me.
I wish the best for you. You still have many options available, and we hope that we can cure this, okay? And what I understand is that you want to remain as independent as possible. You don't want to be a burden to your family. I can help you with all that. Here is my contact information for you. It has my number and the numbers of all of the people that I just talked to you about. And I have written down the date also of that meeting. Okay? Would you like for me to explain any of this to your family?
Yeah.
Okay.
I'll bring my daughter, Blanca.
Okay. All right. Again, I'm hoping the best for you, and no matter what happens, we're here for you. Okay?
Okay.
All right. Let's talk about your pain.
Okay.
All right. Tell me when it did start, or.
The second video also you saw now. So what is the difference between the first video and the second video? In the second video, actually one doctor, one consultant, one specialist will be, will be will be breaking down the report. Before breaking down the report, she takes her into confidence. She actually asks her, so how are you feeling today? Then she'll say, I have some knee joint pain and vomiting sensation, which is not related to the report what she was supposed to say. But she listens carefully. She takes her into confidence, asks her all the details. Then uh, then started telling, regarding the diagnosis and limitations of the diagnosis, and explains her various modes that are available for the treatment, various options that are there in front of the patient for the treatment aspect. Then finally she hands over the information or personal information to discuss with her at any time, including the contact number and other things. What is your opinion regarding this video?
Sir, actually the doctor is very
Your good
good
name?
at her communication.
Your good name? Your good name?
Prachi.
Prachi from? Okay, good. Prachi from Delhi. You can share your experience now. Regarding you can share your view on this video.
Sir, actually the doctor is quite good at her communication skills.
Okay, communication skill is excellent. Okay.
And one shouldn't be blessed into living badly.
Okay.
It will lower the confidence of the patient.
Okay. Okay, good. So communication skill, you could make out. You could make out good communication skill. So she communicated properly. She did her duty properly. She maintained the integrity of the profession properly before breaking down the news. Good. Any other views? Yeah.
Sudha says in second video she treated a patient as if she is one among her family members. And Amrut says she treated her as a family member. Varshishta says doctor is very patient, supportive, and is capable in handling patients as well as their situations with care. And Vanilla says the way she convinced the patient was very good and developing confidence in patient and treating the patient as a family member, and communication skill was also good. Sana said she was very caring and she tried to heal her mental health as well.
So Sana, Vanilla, all your views regarding this video, it is coming very closer. Here the consultant, as I told you earlier, took the patient into confidence.
She prepared the patient to receive the bad news.
Receive the bad news. That is a core point of this video. So prepare the patient to face the bad news, take her into confidence, and at the same time explain the limitations of the test that has been done, that is core biopsy. So many other investigations has to be done. Then treatment aspects, which she explained, removal of the organ or an entire breast followed by chemotherapy or radiotherapy, depends on the staging and grading of the disease. She explained very well. Before going into the core subject, she took her into confidence and prepared her to face this news. That is all about this video. All your observations are near to the core point, and she maintained she did her duty and maintained the integrity of the profession very well. She asked regarding their offsprings, where their sons and daughters are working, are you alone, all those things she announced, and she disclosed, and a very neat way to break down the news and prepare the patient. So I have prepared some PPTs for the duties and integrity. Let me run through those slides. So, duties and integrity of the physician. It's not working. Yeah, I introduced myself already. So I teach pathology, which comes in second year for you. After first year, you will be coming to our department, that is pathology, along with microbiology and pharmacology. You will come to us in second year. So duties and thank you. And just physician basic thing regarding the physician shall uphold the dignity and honor for his profession. The principal objective of the medical profession is to render the services of the humanity. Few of you already told you, it is service to humanity with still full respect to dignity of the profession and man. And physician should merit the confidence of the patient in their entrusted to their care, rendering to each to full measure of the service and devotion. Try continuously to improve the medical knowledge and skills, upgrading your knowledge by attending regularly CMEs and conferences, educative materials, reading the recent advances in your own specialties when you do and of course even your undergraduate period. and make availability to patient and colleagues for the benefit of their professional attainment. That is what I told. ABCD of a successful physician or core values of the physician. A is availability. You should be available all the time. So, integrity is a virtue consisting of soundness and adherence to some moral responsibilities. Character of standing up in their defense when they are threatened or under attack. In spite of all the external pressure, you should stand for something that is with some principles. That is the general meaning of integrity. Integrity and accountability forms the basis of social contract between physicians and society. Friends, let me give you few examples regarding the integrity. Integrity in a general sense, best example is Mahatma Gandhi standing up for some principles in spite of all external pressure. You should stand up for some principles. You should not let the outside pressure on you. You should stand for something, or else you fall for everything. So integrity is, you may be coming across in the various situations in your day-to-day life. For example, you are standing in a queue for a passport. Passport renewal will not happen if you stand in the queue. In Bengaluru, 2 centers are there. In Hubli, 1 center is there. Many states have 2 or 3. Nowadays, it is there in every district headquarters. It's a different thing. Previously, few centers have a passport center. You have to stand in a queue. For example, I am telling, if you bribe, you can get an easy renewal, or else you have to stand in the queue. If such is the situation, if you stand, don't bribe anyone. You stand in the queue, queue to get a passport. So that is maintaining the integrity. Weakness of will correlate well with the integrity. If you are weak at your will, Gandhi Tata, Mera Patkar, so many examples. They started with some principle, fought for the freedom, in spite of all pressures, in spite of so many untoward incidents, so many discooperation. He fought and got us freedom. That is maintaining the integrity, maintaining some principles. So, for example, you will be standing in a queue for voting, movie queue, temple queue, and marriages. In a marriage, to wish your bride and bridegroom, you will be standing in a queue. And in our profession, so for example, for giving a biometry, you will be standing in a queue. You should maintain the queue. And especially in a MC inspection and an NMC inspection, you will not be knowing from at this juncture, but in your profession, you will be exposed to so many inspections where you are supposed to, once you come out of this profession, once you become consultants or teachers, you are supposed to give the head count. You are supposed to sign in front of the inspector. There you are supposed to maintain a queue. So that is integrity, maintaining some principles, maintaining the next person to finish the duty and come, so that you can go finish your duty and come. These are the various circumstances in your day-to-day life other than the medical profession to test your integrity. So next is keeping all these general things aside, next is integrity in the medical profession. Integrity in the medical profession in particular, keeping all these general terms aside, in the medical profession, how integrity helps. Integrity, no doubt, it's a core value of a physician. Integrity, for example, integrity with the profession, integrity with your duty, integrity with your colleagues, integrity with the technology, integrity with the patient communication. All these things are there. So one thing you should know is you should for example, when the patient comes to you, in the available technology, what has happened is total key of investigations. For example, simple chest pain. Previously, we used to examine the patient, then order for ECG, then echo, all those things. With our advent of technology, so immediately key investigations, whatever the patient, ICU patient comes, key investigations will be done and it will be ready for the interpretation. One school of thinking, are these latest technologies are decreasing, are preventing we consultants to think, examine the patient and making us to depend more on the technology. That is one school of thinking. Another thing of thinking is to make the best use, to make the judicious use of the technologies that is available. When technology is available, simple fall, head injury, you order for CT scan. There is no external injury, there is no history of vomiting, no history of loss of consciousness. Still for the better thinking better for the patient, you order for CT scan. Is it? So you may feel that CT scan is not necessary, but in the large interest of the patient, the hematoma, what we saw in that video, it can happen anytime after the head injury. We order the patient who is quite well, who is walking, talking patient, no vomiting, perfectly all right. We order for the CT scan for the simple fall. So there is a debate. So I personally feel that is correct ordering the CT scan in the large interest of the patient. That is judicious use and proper use of the technology that is available, and so that we can maintain the integrity of our profession. So for example, simple chest pain, we may order ECG echo for the chest pain, which is otherwise may be gastritis also. But keeping all the differential diagnosis in mind, even we order for troponin, some enzymes, so that if it is something is missed in the ECG, we can pick up in the blood investigation. So Indian doctors, you know one thing, Indian doctors are the best in outside countries. They used to say they can diagnose tuberculosis without any investigations. Such as the name for our Indian physicians, such is the good trend that is there outside for our good Indian physicians. With the limited or available resources, if you do proper approach to the patient, definitely you can come and near diagnosis. Wherever it is available, you may make use of the technology, but don't over depend on it. Don't merely depend on the technology. Don't stop thinking regarding the 360 degrees regarding the patient possible diseases. So that is regarding the integrity. Next is integrity forms the foundation of the trust. That is what I told, and it grants a professional privilege for self-regulation. So these are the various, these are the 8 core values of the physician. What I told, altruism is selflessness, accountability to the patient, society, and profession. We have to be accountable to the patient. We have to accountable for the society, profession, excellence. That is commitment for lifelong learning. And learning is every day. If you think that learning is over after your 5.5 years or after doing master degree, you are dead that day. So learning is every day. And duty is commitment to the service, honor and integrity, highest standard of behavior and honesty, respect to others, respect to your seniors, giving respect to your juniors as well as teachers, patients, other commitments, just distribution of finite resources, and make use of the available resources effectively. So that is regarding the integrity. Please make use of the technologies that are available and try to come to a correct diagnosis. Next is duties and obligations of a doctor. Duties can be of various types. Duties to the patient, as I told you, duties to the public, duties toward law enforcers, duty to violate professional ethics, not to violate professional ethics, duties not to do anything illegal or hide illegal things. See, even if you don't do illegal things, it is not final. Even you should not hide illegal things, and duties to each other in our profession. Duties to the patient, what it is, I'll just run through fast. Duties to the patient is by giving standard care, providing information to the patient and attendant, taking proper consent to the patient treatment, explaining the patient in their own understandable language. That's why, friends, please learn local language. It is very important for you to communicate well with the patient in your 5.5 years period. definitely it is very crucial. Even if you see one diseases, my teacher used to say 5.5 years period is not enough for you. So try to communicate with the patient, take proper consent, emergency giving priority, that is priority giving emergency care. Next is duty to the public is health education and medical help during natural calamities like drought, flood, earthquake, and recently we saw pandemic. Even the doctors from my department and pre-para were posted to hospital. We did corona duty in the wards, helping the hospital side staff in our limitations by doing our medical help and medical care during accidents. All these are duties towards public. Next, duties towards law enforcers. What is our responsibilities to law enforcers? To inform the police in all suspected illegal activities. And in the casualty, you have separate ledger called medical legal cases, where separate department called forensic medicine will take care of those things along with the casualty medical officer and emergency medicine. And to call the magistrates for recording dying declaration. If the situation comes when the patient is at the death table, they want to communicate something, so make arrangements to call the magistrate to record the dying declaration. In case of suicide attempt, his primary responsibility is to treat the patient initially before reporting. Don't spend too much time in reporting. First treat the patient, stabilize the patient, then do necessary procedures. Duties not to violate professional ethics. Duties not to violate professional ethics is not to associate with unregistered medical bodies, practitioners, and prevent them from doing so. Not to indulge in self-advertisement. So ours is not like any other establishments, business establishments. I told you it's a service establishment. So even the government has recognized that ours is in service service section. They have removed medical profession in all problem discussions from the consumers forum and kept it under KMC in the recent times. So not to indulge in self-advertisement and advertisement near the bus stops and all those things. So it is not applicable to us. And not to issue false certificates and bills. Whatever in your career you may come across so many pressures from all political corners or hierarchy. Don't give any false certificates and bills. Not to refuse professional service on the ground of nationality, religion, race, or whether he is friend to you or he is not good to your family. All those things don't keep in the mind. Just treat the patient. God has given opportunity for you to serve the society and save the mankind. Just do it and forget the rest. Professional misconduct. Not to indulge in abuse of powers, bias, sexual harassment, breach of confidentiality, arrogance, greed, misinterpretation, impairment. All these things we should not indulge. Not maintaining the medical record. This is one issue. It is not like in previous time. Now with available technology, help you can keep your patient data very safe. For example, each test or each patient data, there is a guideline, government guideline you are supposed to maintain from that particular period. For example, me being a pathologist, if somebody gives biopsy to me, I'll maintain those records for 10 years. This is a standard thing, and I maintain those specimens, cancer specimens, for 3 months with me. So such is the thing. I am just giving one example. If you are a consultant, patient will come to you, that record should be maintained in a good manner. As and when it is required, you should be ready to share because it's a patient property. And not displaying the name and register number. This is again part of unprofessional misconduct. Your name should be displayed properly even in the letter, including the KMC register number. Duties to each other. What is duties to each other? Doctor must give his teachers due respect and gratitude. That is giving respect to his teachers, his colleagues, his students. So that is, you should do. Teachers should behave to colleagues as he expects to them, behave to them. So when you expect somebody to behave to you in a very decent manner, in a similar manner you should behave with them. So difference of opinion should not indulge, should not be divulged in public. For example, any expert difference if you feel with your colleague. So sometimes you may be right, you may be wrong, or whatever it is. you should try to educate your colleague or share your experience within the four wall, not in front of the patient, just to focus that you know everything, that person don't know anything, and you are a master of this subject. You should not do like that. Medicine is not, friends, medicine is not 1 plus 1 is 2. Medicine can be 1 plus 1 equals to 4. So please understand the science, help each other and help your colleague. Ultimate goal is to serve the patient better, serve the society better. So these are the slide. This slide is discussed with you so many times, and roles of a doctor. I will not go in detail regarding this because my duty is to focus only duties and liabilities. Thank you friends for your patience, listening and interaction. And I once again thank you for all people who made this foundation course possible.